Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why.
Good evening, everyone. Glad to have everyone joining us in terms of our uh, show, our podcast. We do have this evening. Well, I hope first of all, playing Miss Turner's role, which Miss Turner won't be here this evening. She's got some other obligations, so you got to put up with me. You are truly by himself. So hopefully you enjoy the podcast just as well. But it's a great day in Northeast Florida. It was a nice, calm day, beautiful day. The weather was cooperative, temperature was cooperative, I was cooperative until I had to go to work. Um, so this week we're gonna have we're talking about kidney disease and kidneys, good kidneys, bad kidneys, and of course our guest, which we've had on before, is Dr. Deborah Price. Dr. Price is a nephrologist here in Jacksonville. And um, can you tell us, Dr. Price, give us a little bit about your background and what made you decide to specialize in nephrology?
Okay, I guess, I was a chemistry major. And as a chemistry major, you have to do a lot of acid base electrolyte monitoring. And when
Right.
I got into medicine, nephrology actually does that. The kidneys just don't make urine. They just don't, they filter the blood, they make sure the electrolytes are appropriate. If you eat too much potassium, you'll excrete it in your urine. If your sugar's too high, you'll urinate it out. And also the acid base is involved with the kidney as well. So I like that, but I have to be honest, what really turned me on to nephrology is the dialysis patients. Because with the dialysis patients coming 3 days a week, I really got to know them well and their families.
Wow. I mean, that, well, let me put it this way. I thought nothing like that in medical school. I thought nothing like that because I thought that was very difficult as far as acid-based dialysis, and to this day, I still think it's very difficult. But hey, that's why I'm not a nephrologist, and you are because you're better at it. You appreciated what you were um, looking at more so than I have. For me, it just didn't click. So, what do you can you give me any personal experience or stories that shape your approach to kidney disease and why especially as it relates within the African American community?
For kidney disease, well, when I look at our patients with kidney disease and on dialysis, there is an overwhelming amount of young African American patients. They seem to develop kidney disease at an earlier age and it's more aggressive. And all the education in the world sometimes does it just doesn't help, unless they change their lifestyle. So this is why I continue to do it, trying to educate patients on, their diet, exercise, losing weight, hopefully not developing diabetes or high blood pressure.
So when you say the younger folks, that means they have a worse. Are we saying that they have a worse statistics as far as it relates to kidney disease compared to the mother and the grandfather, and or is it just because we keep statistics better?
I think it was always going on, but it's just that in their grandparents, they just didn't know they had kidney disease because they didn't go to the doctor. They didn't
Right,
take their blood pressure medicine because they felt fine.
right. Which is what we hear a lot of. I feel fine. Why I need to?
And
Why I
kidney
need to take
disease
this
is a
blood?
silent disease. And, people see urine coming out, so they think their kidneys are fine, but a lot of times they may not be.
So, and I remember looking at that on several occasions. Like you said, it's a silent disease, and so because people don't feel it, they don't think twice about it. Then with that, what's the primary function for your kidneys? What is it that the kidneys are responsible for within your bodies? So we can try to get people to appreciate
Hmm.
why the kidneys are so important.
Well, they get rid of waste. So the kidneys filter the blood several thousands of times a day, and it gets rid of waste products. The liver also gets rid of waste, but so both of them sort of 50-50. The kidneys get rid of extra fluid. The kidneys also have, like I had mentioned, involved with electrolytes. So they keep the potassium and sodium at a normal level. Also, the acid level in your blood, they keep it stable. The kidneys also have hormone functions, helping with anemias or preventing anemias. It secretes a hormone that helps keep your blood cells alive longer. And the kidneys also, well, I guess that's probably about it with the kidneys.
I've seen some of the data that says that when um, if you look at a person and they got excellent functioning kidneys, that may be a predictor how long they live. You ever heard that before?
Yeah, I mean, people with kidney disease do tend to have a higher mortality. Yes. It used to be the most common cause of death was infection, and now
Mm-hmm.
it's cardiac, but
Mm-hmm.
infection is number two.
Mm-hmm.
So this is
Cardiovascular.
one, yeah, this is, yeah, cardiovascular. So, when with the statins now, a lot of people are surviving their first heart attack and coming to dialysis.
Right. So what's the equivalent of the statin as it relates to your heart, and your cholesterol in terms of kidney disease? There's some magic uh, pill
Well,
out there.
Well, yeah, I always look at the cholesterol and triglycerides. A lot of people think, it's for the heart and the vessels there so they don't clog up. And yes, that's true. But you have to remember the cholesterol and the triglycerides are floating around in the blood, and the
Everywhere.
kidneys filter the blood. And the blood vessels of the kidney are microscopic and they clog up a lot quicker than those of vessels of the heart. And we can't unclog them as of yet. We can't do stents and angioplasties on those innermost vessels of the kidney. So control of your lipids is important for
Yeah, I
kidneys.
do think that heart disease has taken a more dominant press as opposed to kidney disease as it relates to the cholesterol related issues, especially.
Right, right. And I always say you have to have a good heart. People who have heart disease, a lot of times they do have kidney disease because the heart pumps blood, and if the heart is not pumping blood to the rest of the organs, they're not going to do well. And the kidney is one of those organs that gets 25% every time the heart pumps out blood. And if it doesn't get it, it's not going to work very well.
Yep, yep. It's just blood is it just passes through the heart, but while it passes through the kidney, it serves a different function in terms of accumulating and dislodging, like mostly dislodging the contaminants within the body and so on and so
Hmm.
forth. So what are the leading causes of kidney disease, especially as it disproportionately affects African Americans?
It's diabetes. Diabetes in this country and in the world. And in the African American community, high blood pressure is a very close second.
There you go. Yeah, 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 yeah. Well, yeah, they did teach me that. That's one thing I kept in mind from residency is that, diabetes, high blood pressure, and then they talk about kidney disease because and cardiac disease, obviously, because it's cardiovascular disease. Okay, so what's some of the early warning signs of the silent killer that you just discussed? What's some of the early warning signs of kidney disease?
Well, that's funny because there are people that I see that probably would be on dialysis in another month or two. And I'm seeing them for the first time. And they say to me, I feel fine. I feel fine. They don't
I don't know
believe
why
me.
Dr. Kane sent me there.
So they feel fine. Things that happen very acutely, however, you do feel that. Say
Right.
let's say you take some kind of poison that affects your kidney, like antifreeze. People do drink
Right.
antifreeze,
Right.
and it'll wipe out your kidneys very quickly. And when that happens, you stop urinating, so you'll get really swollen. You're gonna have shortness of breath because you're gonna fill up with fluid, and you're gonna have electrolyte problems, which might not make you feel good. You'll get nauseous, throwing up, just don't feel good overall.
Okay. So what we do tend to see then, so if they feel it, much like that's why people also complains about blood pressure. I mean, people state about blood pressure, well, I don't really feel anything. So, you know, because they don't feel it, they don't stay on top of their blood pressure, which then they're not staying on top of the blood pressure, they're keeping it lower, it being number two cause of kidney disease. And what do they think the outcome is going to be? I don't think they connect the two, I guess is what I'm looking at.
Yeah, that's true. And they feel fine with their blood pressure being sky high. And I usually tell people, the day of your stroke, you feel quite fine. You
Right, right. Before the stroke.
know.
All right. So at what age would you suggest to people, especially in the African American community, what age would you suggest that people start getting screened for kidney disease?
Well, I guess a lot depends also on your family history. If there's a family history of kidney disease, say for instance, if you have a sibling who has diabetes and has kidney failure, there's a 50% chance that you will also have it as well. And so some diseases you might want to start screening at age 30,
Right,
especially if you have diabetes and high blood pressure. And sometimes the kidney function looks normal, but you have stuff in your urine, like blood. Sometimes it's hard to know where the blood's coming from. It could be coming anywhere from the kidney to the urethra. But when it's coming from the kidney, it usually tends to be very aggressive, meaning your kidney function drops down pretty quickly.
so what do you think? So since you mentioned that about blood and sometimes things in the urine, tell me some of the things you should look for if in your urine, anything else you should look for that might suggest one has kidney disease.
Okay, well, looking at the urine to make sure there's no blood or pinkish stuff there or it doesn't look very dark.
Okay.
Also, looking at the urine to make sure it doesn't look very sudsy. I mean, sometimes when you urinate, especially when you're young, the force that the urine hits the water, it's going to bubble a little bit. But I'm talking about foam, like say when you put dish detergent in the sink and then turn on the water, it
Right.
foams up. That could be a sign that you have a lot of protein in the urine, which is not good. Protein does not usually appear in the urine.
That's
And
the kind
this
of an early sign of the kidney disease. If you got protein appearing in the urine, we may have
Right.
significant issue, right?
That is right. And sometimes it appears even before the kidney function drops down. So, the kidney, like I'd mentioned, has filtering capabilities for smaller molecules like water, sugars, electrolytes. But you normally do not see protein in the urine because it's such a big molecule. So when you see it, there's something wrong. There's some destruction in the kidney. And we try to get rid of it because it going back and forth through the kidney is actually toxic to the cells.
So when you see that soap suds in the toilet, you need to start. I wonder if something going on with my kidneys. And if you haven't been doing your routine checkup, like
Yes, it
we
does.
encourage people to do, then
Hmm.
maybe it's time to go see your primary care doctor who may say, yeah, you need to see the kidney doctor or you need to see this person. Yeah, not doing one of these self-advertising, self-promoting modes. But again, we are on the front line and we tend to see people at the initial or at some point earlier in kidney disease than you guys do because you have such a level of expertise that, a lot of times you're looking at the more uh, problematic patients as it
Hmm.
relates to kidney disease, especially. Some of the
Hmm.
other stuff we can do as primary care physicians, and because we don't have another guest, I have to play both roles. Sometimes, some of the other times we have to, as primary care physicians, take a look, and we have to help a person discover that they have some kidney issues,
Hmm.
and appropriately or inappropriately refer them to the specialist so that just in case, you know, you got something that you're not quite sure of, then it's better to err on the side of caution
Right.
uh, than not. So sometimes I say, well, Dr. Price might wonder why I'm sending her this patient. And here's the other social aspect she may not know, you know, but I'd rather send it to her. And if she has a question, I would hope, and I know she has, asked me was anything in particular I looked for. Why did, maybe have a discussion as to, you know, might be a reason behind this person's issues that I sent that person there for. Why I sent her there or him there. She can tell me and enlighten me on like, yeah, it might be a little concerning, but it's something that I think she can manage, and this is what you need to do. So she give me further instructions on how to manage that patient if she does not need to see them. But she'll see them if I don't know.
Yes, yes.
All right. So, any other early warning signs on the kidney disease issue? Anything else? I know we
Early
talked
warning,
about soap.
sometimes, having swelling, because sometimes when you have a lot of protein coming out, what
Uh,
it does is it causes the protein in your blood to drop down. And when it drops down, what happens? You start having swelling. And this is because protein, being that big molecule, normally is in the blood vessel and it holds fluid there. So when the protein goes down in the blood, the fluid will seep out into the tissues and you see a lot of swelling. Not that you're overloaded with fluid, but the fluid is displaced in the wrong place. So you might start noticing swelling in your feet, ankles, sometimes your hands or face.
yeah, that old, if some of those that remember in college, osmolarity and osmolality, in terms of the concentration of substances within the blood holding the water inside the blood vessels. But if
Mhm.
that concentration goes down, then the water goes with it.
Right,
Okay, which then goes into the extremity and get to the swelling in ankles and whatever.
right.
Yeah, you know you're bad off if you get that swelling all the way up to your backbone. That's a lot of trouble.
Well, yeah, the swelling is dependent. So, sometimes when you lay down at night, you'll notice that on the back you have an imprint, you know,
Right, right,
because you've
right.
been laying down.
All right. So let's talk about transplants. Well, what time we got here? Before I get to, we still got some more. As far as our mid section. So let's talk about transplants. Why is there such a mistrust of the transplant industry within, the nation and maybe even in particular Jacksonville?
Yeah. Normally when your filtration or percentage of function drops to 20, that's when you can be evaluated for transplant. And I encourage people to go because your chance of survival is much better with a transplant than it is being on dialysis. But I do get a lot of pushback. I get a lot of pushback, especially those in minority communities. And I do ask them why. Why not? Well, I want to go back to God with my organs. I don't want anybody else. I hear that.
Right.
Also they're afraid of the surgery. They think that something might happen. Also, it's costly. You have to have this transplant workup. A lot of insurances pay for it, but some do not. So it's very costly. And you also have to have a caregiver when you go to all these appointments. And sometimes that's hard because, your spouse or whatever may be working. And now a lot of the transplant centers are requiring two caregivers to come with you, which is really hard.
Well, since you mentioned costly, there are other aspects of the cost to it as well, right? So if you got these caregivers, one or two, based on what you just asked, that's costing them money.
Right.
Sometimes it costs you money because you may have to pay them, right? And then if you're an individual who's working, especially within our community, more than likely you're working on younger age where those kidneys are at their best, to be transplanted. And if you are working, then that also now costs you, um, to participate. Now, if you're already dead, I guess that's not an issue. if you're a donor, I guess, instead of a receiver. But if you're a donor, that might not be the issue in terms of cost. So, what are we looking at when it's a donor? Because we want them to volunteer. Got to have some kidney to transplant.
Hmm.
So what are kind of the issues are we looking at in terms of mistrust with the donors?
Well, the donors are always are thinking because I have had patients trying to convince their children that they need to give them a kidney. And it should not be that way. You know, they should volunteer. But a lot of the children will say, you know what, I might need one of my kidneys for my kids. So they don't want to do it. And then, some do, but, they have to take off from work. So it's a cost. Some insurance companies don't pay for all those tests because they have to be evaluated as well.
Right. What about those donors who are no longer with us for whatever reason?
Mhm.
You donate your kidney, but a
Mhm.
lot of them are not signing on for organ donation. I guess is what I'm trying to get to.
Oh, like a cadaver
Right.
transplant. Is that what you
Or
mean?
yeah. Well, I mean, if I signed off on my driver's license that I'm an organ donor, some people feel like, they might come in here and just unalive me a little early. That's some of the mistrust stuff. Unalive me a little early. So I don't know if I really want to be a donor on record or want to be a donor at all for the same reason you said I want to leave with the same parts the good Lord gave me.
Yes, I have heard that. I have never experienced that or seen that. But
Uh,
yes, someone comes in after a really bad accident and they're brain dead.
right,
And, they're on life support, meaning on ventilation and whatnot. Their kidneys are good. The doctors do approach the family about, donation. And sometimes there's a lot of pushback, even when they have on their driver's license that they're a donor.
right.
The family will say no because they think not everything is being done. They want to make sure everything is being done before, you
Right.
know,
Which
they can
makes
do
it
it.
difficult for the medical providers. I'm not saying justly so, but make it difficult for them unless they've already won some level of trust
Yeah.
that they're going to look at what's the best thing for them. And I guess that's what comes back to their, if not their primary care provider, as well as their specialist provider like yourself, being able to trying to convince them, yeah, let your mom kidney go to yada yada yada. Let's do this, that, and the other.
Hmm.
So medical mistrust, I guess, is what I guess I'm calling it. And we see quite a bit of it
Well, that
for
exists.
other reasons. Go ahead, I'm sorry. We see quite a bit of it for other reasons, Tuskegee and all the whole 9 yards are related to that. But all right. So just keep trying to keep track of time. Um, although you don't have to be the one to keep track of time. Tell me the difference and that's what I was just talking about the living donors. I already went through that risk benefits. Uh, let me put it this way. What would be the biggest risk for living donors giving kidneys to whomever, whether it's mom, dad, children, whatever?
Hmm. Okay. And so, they will tell you in the transplant world that there really isn't any risk. They say that over time you may develop high blood pressure, but that's hard because high blood pressure is so prevalent that they may have developed it anyway.
Right.
Sometimes you develop protein in the urine, over time. But again, with high blood pressure, you may have done that anyway. We do know people who are born with one kidney have great survivals, and you can live with one kidney. So,
And not automatically be assigned uh, have the chance of not developing high blood pressure or
yeah,
have the
not
chance
not
of
all
not
do.
having whatever.
Yeah, not all develop high blood pressure.
Okay, all right.
And sometimes, if you're young, let's say you're donating to a small child, like you're 30 years old, you take
Hmm.
out one kidney, the other kidney will grow a little bit. It will kind of get bigger to kind of compensate.
Okay. Uh, uh, within the time before halftime, that's called it. Dialysis versus a transplant. Uh,
Survival is better with a transplant.
okay, all right.
Yes.
Because long term dialysis, while it may keep you alive, is there any? Well, I think I know the answer to the question. But what's the downside that if you can't get the transplant? I know the upside is just still can dialysis and being alive, but does each dialysis episode take anything away from somebody, or can they always bounce back once they start dialysis under whatever circumstances, or what are the circumstances where dialysis may not be permanent?
Oh,
Uh,
in acute situations, let's say somebody comes in with bad pneumonia. A lot of times when you have infections, it does bother the kidneys, especially if you have some underlying kidney problems. And people may go on dialysis. The pneumonia will get better, but you're on dialysis. But we give it about 3 months, continuing to check, and sometimes it does bounce back. So there is that acute phase. And usually, for those who have stopped urinating or urinating less than normal, when they start urinating again, that is a big sign that your kidney might be recovering, and people do come off. So things that happen acutely, things that happen chronically and slowly, they tend not to recover.
okay. Somebody asked the question, what happens during dialysis?
What
Uh,
happens during dialysis?
yeah, but before we get to that one, since you did mention real quick about injury, we have acute kidney injuries, and we talk about, you and I, when we talk about acute kidney injuries, we know what we're discussing with one another.
Oh,
For the
okay.
lay people, would like to discuss a little bit about acute kidney injuries, and we can come back and answer that question. But acute kidney injuries and what can cause it, and
Hmm.
anything that stands out in the discussion that you need to.
Okay. So somebody with normal kidney function could be young. Let's say they develop the flu and they become very dehydrated. They're throwing up, having diarrhea. They're very dehydrated. Okay? And they have abdominal pain. So they all come to the hospital, and the first thing they'll do is a CAT scan and give them intravenous contrast. The contrast sometimes is bothersome to the kidney, and it's one
Contrast being the dye, right?
the
Just
dye, yes, I'm sorry, the dye that they will put in through the IV. And things are always much worse with anything, any risk when you're dehydrated. So they get that, and then all of a sudden it sits in their kidney because when you're dehydrated, your kidney is trying to hold on to everything and it's holding on to that dye, and your kidney function will be injured and you may end up on dialysis. So that's something acute, and
right.
that may recover.
Okay. Something happens in a quick, fast, and in a hurry.
Right.
Uh, um, what else can cause that acute kidney injury?
Some toxicities like poison can cause that. Um,
You mentioned one before. And that was antifreeze.
Antifreeze, yeah. And we do see people who do that. Usually they're alcoholics who can't get a hold of alcohol, and they do drink antifreeze.
Wow.
That will wipe their kidneys out, but unfortunately, you aren't coming back from that, you know.
Yeah. Okay.
Yeah.
They
But
get some kind of crystals or something, right?
right, right, right. Another common thing that people use are these anti-inflammatory drugs. Things like ibuprofen, Motrin, Aleve, Advil, Naproxen, Meloxicam, Celebrex. If you're dehydrated and you have underlying kidney problems, acutely, it could bother it. They have done studies because we always thought it was people who had underlying kidney injury or were elderly that had problems with these pain medicines. But they did a study in young Navy recruits. And, they were young, 18, 19 years old. They gave them ibuprofen, 800 milligrams, 3 times a day, and they followed them. And they found that there was a certain amount that developed kidney injury. They
Wow.
stopped it after a year. Most of them returned back to their baseline, but some did not.
And that could that have been dose dependent? How
Well,
long
they
how
gave all
frequent?
of them 800 3 times a day. So it was the
Oh,
same
okay.
dose. Their level of hydration may have mattered, if they were more dehydrated than others. Navy
So that
recruits
means
running around, they may be.
yeah. So we really don't know who, but you just want to use as little or as less than non-steroidal anti-inflammatory NSAIDs, the Motrin-like drugs. You
Yeah.
want to use as little of that as possible. One last quick question: that they used to talk about celebrating Celebrex because it was supposed to be less renal injury, less kidney injury at one time. Was it being touted as that? Yeah, I know salespeople had to do their job, and that's what they said sometimes. But just for the other practitioners on here, we just want to clear up any misconception about Celebrex, if on my part or whatever. Misconception about Celebrex being okay to take it doesn't cause as much damage as the other guys.
I think it does, you know, just like all the others. Yeah.
Just like the rest, right?
Yeah.
All right. So now we're at half past our program time. We're at 7 o'clock,
Yeah.
and Tyrone usually comes up with one of the wizard comes up with one of his wizard creation. Tyrone, where you at?
I bet you didn't know that African Americans are almost 4 times more likely to develop kidney failure compared to other ethnic groups. This is Pause for the Truth Mid-Show Minute, March 25th, 2025. Today, I want to talk about something really important, navigating kidney disease, especially within our African American community. Did you know that African Americans are almost 4 times more likely to develop kidney failure compared to other ethnic groups? It's a shocking statistic, but we're here to make sure you don't have to go through this journey alone. First off, let's talk about what kidney disease actually is. Your kidneys play a crucial role in filtering waste and excess fluids from your blood. When they don't work properly, waste builds up, and that can lead to some serious health issues. But here's the thing, many of us don't even realize we have kidney disease until it's in the later stages. That's why regular checkups are essential. If you have high blood pressure, diabetes, or a family history of kidney issues, it's even more critical to get screened regularly. Now, I know dealing with a diagnosis can be overwhelming. Trust me, it's okay to feel scared or confused, but remember, you're not alone. There are countless resources and support systems out there for you. Talk to your doctor, join a support group, and lean on your loved ones. One thing that can make a huge difference is lifestyle changes. Eating a balanced diet, exercising regularly, and keeping your blood pressure and blood sugar levels in check can slow down the progression of kidney disease. It might be tough at first, but making these changes can significantly improve your quality of life. Let's talk about dialysis. For some, it's a necessary part of managing kidney disease. It can seem daunting, but many people lead full, active lives while on dialysis. The key is to stay informed and work closely with your healthcare team to find the best treatment plan for you. Another important aspect is mental health. Dealing with a chronic illness can take a toll on your emotional well-being. Don't hesitate to seek professional help if you need it. Sometimes just talking to someone who understands can make all the difference. And let's not forget about caregivers. If you're supporting a loved one with kidney disease, your role is incredibly important. Make sure you also take care of yourself and seek support when needed. In the end, navigating kidney disease is a journey, but it's one you don't have to take alone. Stay informed, stay connected, and stay hopeful. Together, we can make a difference. Thanks for watching, and don't forget to subscribe for more insights and support. Take care.
All righty. All right, that was pretty good, Tyrone.
Yeah.
Informative, stole a little bit of what I was going to ask, but we're going to ask it anyway. So, obviously, you know how I roll. I want to talk a little bit about health, the systemic disparities in terms of what we see in terms of kidney disease and some issues that may be, sometimes we want to address. At one point in time, when people were looking at the EGFR, there seemed to be a different standard for African Americans versus Caucasians. Let's talk about that a little bit. Because my patients sometimes took the level of comfortability that they were not in that abnormal range because they were Black. And you're going, what that mean, Dr. Kane? And so tell me, what kind of discussion can we have on that?
Okay. But first, I have to tell you something really funny. One of my Caucasian patients told me, who was on dialysis, He said, if I have a kidney transplant, I want a black kidney. And I said, really? I said, why? He said, because black people have better kidneys because their GFRs are higher.
Yeah, you don't know what kind of trouble he was asking if I did it.
So, the way it has been reported pre COVID, actually, and it's medical students who brought this up. They were like, well, what are the studies that show that the EGFR for African Americans is a little bit higher? And really, there are no studies. What it was someone said, well, African Americans have more muscle mass, so we have to compensate for that. So the creatine that we use is a muscle enzyme. So
Right.
if you have higher muscle mass, then you have to compensate for that. No studies, no research, and that's just how it is. So every time you see a GFR for a Caucasian, you multiply by like 1.4 and you get that higher creatinine. So we realized it wasn't. Everybody's kidneys are the same. So that GFR of the Caucasian is probably what the African Americans call EGFR. And EGFR is like the filtration or the percentage of function. So that was not good because we thought that the African American kidneys were better when they may not have been. So they weren't referred to a nephrologist, like the Caucasian was earlier. And also with transplant, you have to have a filtration of less than 20 to be evaluated. So if yours is higher, which is probably the same as the Caucasians, less than 20, you're not going to go for a transplant referral. So it kind of hits both ways.
So to summarize, because I'm black, I would be less likely. Remember, EGFR stands for estimated glomerular filtration rate, and it's the rate by which we filter our urine of these poisons that you mentioned, those metabolites, and yada, yada, yada. But as an African American, I go in and I get my kidney functions done with, I'm just going to, for example, say that 60 is the normal. I'm at 70, but my Caucasian friend is at 59, right? Which is
Right.
below normal for discussion's sake. They're more likely one to get their kidneys grade evaluated than I am, right?
Right.
They're more likely to receive dialysis earlier than I would, correct?
Probably.
And they're more likely, probably, all things being equal, as what we described, they're more likely to get a transplanted kidneys than I would qualify
Right.
for, being a kidney recipient than I would.
Right.
And then so I'm more likely to die before they would.
Yeah. Yeah. That's true.
Okay. All right. So I do know the NMA and others fought to try to standardize that, where, as what you said, don't multiply it by 1.4, show it as it is. Which would be, but what makes me different than a white guy? I mean, that's some genetics about some things, but you can't say this because you've never done the studies.
Right.
You can't
Right.
prove it.
Right.
So they made an assumption about we being better athletes because our muscles are bigger and all this other stuff. So our kidneys were better simply because we were black.
Right. And that never made sense to me because when you look at the studies, you see that African Americans have more kidney disease and at earlier ages. So I couldn't understand why our kidneys were actually better.
But and I said all that because I wanted the audience to realize the role that their kidney doctors and their physicians who advocate on behalf, because I am still Northeast Florida Medical Society, and this is the Northeast Florida Medical Society show, a podcast, that we advocate for fairness with everybody in the community, not just only, but everybody in the community.
Yeah.
But there's a discrepancy, a disparity. We need to bring it out and show it as it is. That disparity is one in which we receive the best care for our kidneys, not because the individual has decided that they're going to be anti-black, but because of the systematic norms that go against African Americans. That's not too heavy of a statement. All right, so the other thing is, so with that being the case, and because not all Black patients see Black physicians, or I also have white patients. How do patients advocate for themselves in terms of, getting the proper care for their kidney disease, for any issues, but in this case, we're talking the right care, proper care, understanding the proper care for their kidney disease.
That is hard because first you have to claim that you have kidney disease. If
Okay.
you don't think you have it, I urinate fine is what I always hear. So that you have to first realize there's a problem. And I think you need to educate yourself. And sometimes grandma can't do it, but your grandchild or child can,
Right.
advocate for you. So,
Okay.
and
So,
it's doing things
wait,
like eating right, watching the weight, exercising, making sure you're taking your medicines, you know, controlling the blood pressure, the diabetes if you have it, and hopefully you won't get it if you keep good lifestyle, changes.
so there at least one of the things we should at least be looking at as uh, clinicians, because APRNs, physicians, and PAs, and whomever these days taking care of kidney, specialists and non-specialists, taking care of people with kidney disease. One thing we do need to consider is how do we make sure um, we need to educate our patients about kidney disease. Need to just kind of make sure that they understand what it means, how to get it, and then ask the question. So if we had a statement to say this evening, we would say, go ask your doctor, what are your kidney functions like? Not just
Right.
that your blood work is okay, but what are your kidney functions like?
Right. Yeah, you do have to because a lot of patients will say to me, well, my doctor has told me through the years that everything is fine. And when I look at it, it really is not fine. Their filtration hasn't been good. And it's just that it's dropped more. So they see me now.
Right.
So, and,
Yeah.
and the other
Go
thing is
ahead.
that,
Go ahead. Go ahead.
we're,
Go ahead.
oh, I'm sorry. Go ahead.
No, I was playing. Go ahead. I'm sorry.
No, I said a lot of people look at that filtration rate of less than 60 as being, or greater than 60 as being okay. But if you're 20 years old and your filtration is 62, that is not normal.
Nope.
When you're born, your filtration should be about 100, 110, and it should
Right.
stay up there till you're about 40 years old. And then it slowly drops. So somebody who is even, say, 50, I mean, I would expect their filtration to be in the 80s still.
Exactly.
So I don't, so you can't just say greater than 60 or
60.
whatever. It's okay. It's not.
Right. Yeah. Yeah. That's a relativeness in terms of how you look at that. But truth be told, I got a patient. She's like 94, and her kidney functions is like 87.
Wow, that's good. That's
She
very
is.
good.
I'm just amazed with what she got, but then I also have some patients who kidney functions they're 99, and their kidney functions is 24. Now, at 24, we kind of worried about, we start looking at patients, but I'm going to 99. What do we,
What are we doing?
what do we, what do we want? So I think patients, I agree with you. What patients need to make sure they do is that they discuss with their doctor about kidneys, and how healthy are their kidneys, or did they have it looked at. And then if they're sent to a specialist like yourself, to make sure that they be ready to ask some questions, so that they can get a better understanding about the kidneys. Because I know, you're more than willing to educate patients on their kidney functions and what it means, and it's not just blah, 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 why. And what sometimes that's what patients hear. Blah, 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 blah. But
Well,
when presented, you do it correctly. So because my patients tell me that.
well, I think it's always nice for you to bring another set of ears with you when you
Right.
come to, especially the first time. Because I ask patients, when they first come to see me, they think I'm going to put them on dialysis. And that usually is not the case, but so I don't think they're hearing what I'm saying all the time. So it's always nice to have another set of ears, you
Yeah.
know, to listen.
Because they're quick to say, Mama, that's not what he said. I've been there. Mama, he didn't say that. You tell me I'm about to die. No, that's not what I said. All right. So, what about community resources? What kind of resources we have in Jacksonville? Well, let me before I get to that. Is there anything special about Jacksonville that may increase a person's, particular African American descent, but increase any individual risk for having kidney disease? Anything that you're aware of, local issues?
I would say the diet, because living in other parts of the country, this southern diet, these comfort foods that we have that taste so good, that are so high in salt and processed stuff, is
Crab
probably,
balls.
yeah, not good for us. It bothers our blood pressure or bothers our weight, you know, the
Okay,
sugars. Yeah.
that's one. So, any give me some of the organizations maybe locally that you're aware of that people can, or resources that people can reach out to try to get educated on kidney disease, because not everybody needs to see and hear from me or see and hear from you, because it may not be applicable. They may have perfectly normal kidneys, but they're caregivers, so they may
Yeah.
want to be educated as well on what is going on with mom, sister, brother, dad, because child, since kidney disease can affect any of those
Yeah.
individuals I just mentioned.
Well, I think a good resource is the National Kidney Foundation. If you go to their website, they have a lot of information about kidneys per se. They have a lot of diets, and you have to watch with the diet. I usually tell people that it depends on what your labs and your stage of kidney disease. You don't need always to stop eating potassium. I always think a low salt diet is good,
Okay.
but you don't always have to watch your phosphorus. It depends on your level of kidney disease. But the National Kidney Foundation is a good resource, and they have local chapters around, the area, around the nation. And actually, we're going to have a kidney walk. So the National Kidney Foundation will be here in Jacksonville. It's going to be on Sunday, May 18th. Going to have a kidney walk, and
Okay.
there will be people here from the National Kidney Foundation, the Jacksonville chapters along the state, and you'll see a lot of other kidney doctors practices. You'll probably see dialysis patients out there as well. But it's going to be in, I think,
May.
Riverside Park on
Okay.
Park Street, yeah, on the 18th, starting at 10 o'clock in the morning.
Send that info to Tyrone or wherever he can get it, because we will put it on our website for our listeners to be able to
Okay.
take a look at it. And if they
Okay.
want to participate, to actually, come out and join. Um, so we just a source. We just going to be a resource source by which to go take a look at it. But we're also going to put it on the national website. I'm trying to remember. I can't remember any local websites to name what they are, and any different than National Kidney Foundation. I'm not sure.
Another website is something called kidneyschool.org,
Okay.
KIDNEYSCHOOL,
Okay.
kidneyschool.org. That gives a lot of, it's in modules, gives a lot of information on kidney disease. They talk about dialysis, transplant, because I usually have my patients look at it and we review it, during the office visits.
Kidney
Uh,
Walk
Kidney School.
School. I'm sorry. KidneySchool.org.
.org.
Taking a look at it. You encourage them to look at that before they get there, and then you guys also discuss it if you have an opportunity to talk to them before they
Well, I kind
actually.
of briefly kind of overview, and then I
Okay.
ask them to go to the website with their families and kind of review it. It's hard because it'll be 3 or 4 office visits, and they keep saying, "Oh no, I haven't looked at it," because they're afraid to look at it. But when they finally log on, they actually find it's very informative, and I think education is very important.
Well, as a primary care provider, I never did, but I need to go on ahead and
Oh,
start
that's
asking
it. Yeah.
before you go see Dr. Price, go look at this website. And what I point to, go look at this website, so that when you get there, she'll be able to discuss some of your questions and so on and so on with you. Okay,
Yeah.
makes a lot of sense.
And
All right.
there's another website that people may be interested in looking
Okay.
at their risk factor for kidney disease.
Okay.
Okay, it's kidneyfailurerisk.com. It's just that
KidneyFailureRisk.com.
right.
As you can see, Tyrone been on it, so he's going to probably put that up. He's been putting it up.
Oh, okay, yeah,
Putting
okay.
up each one of those websites as you mentioned.
Yes, because they'll ask things like, do you have diabetes? Do you have high blood pressure? Do you smoke? Which, by the way, I haven't mentioned, but smoking is not good for your blood vessels. It causes narrowing of the vessels, causes cholesterol buildup. And, the kidneys have a lot of blood vessels in them. So if they get destroyed, the kidney is not going to function very well.
Yeah, I tell some men, to be honest with you, and I know this is more a urological concern, but I also tell them, like, well, look, if you're kind of 45, 50 years old, you got some erectile dysfunction, that may be an indicator of uh, arterial damage
Yeah.
because of the cholesterol. No different than when we talk about heart disease and erectile dysfunction as being one of those indicators or sub-indicator of heart disease. It can also be an indicator, sub-indicator of kidney disease
Hmm.
because cholesterol just collects in these damaged vessels, and there's nothing written in stone that says only the vessels of the heart will be damaged or only the brain vessels will be damaged. All of them, maybe not equally in terms of time as they go on, but the amount of cholesterol deposit in a large vessel doesn't take long. It doesn't take much if that same level of development occurs in the small vessels, and then with kidneys having the smaller vessels and those intricate within the kidneys itself, having smaller vessels in the heart, then you can see kidney damage very readily. Just because of elevated cholesterol and diabetes. Same thing we talked about.
Yeah.
Top 5 indicators of sudden death uh, in terms of heart disease and so on and so on. All right. Listen, this has been a very interesting conversation. I am, so happy, Dr. Price, you came on and helped me get through this conversation, made it so easy for me because you very educated, educational in terms of letting my patients know what's going on with their kidneys and of course with our audience just now. I would like to ask, there anything else? I know this was National Women's Month and we talked about it before. I think National Women's Month, is that it?
Yeah,
Uh,
in March, yeah.
yeah. What can you tell us on that one? I know we talked about
National Women's Month?
yeah. Anything you want to say to it or does it make a difference? No.
No, I think, no, not really. I was going to say women probably have less kidney disease than men, but, you
Okay.
know.
All right.
But what I did want to mention is that probably in the United States, about 40 million people have kidney disease.
Uh-huh.
And of those, about 750,000 are on dialysis. So what
Okay.
I'm saying is most of the people who have chronic kidney disease do not end up on dialysis or needing a transplant. So my goal is to try to prevent that. But you got to work with me on that.
Meaning the patients, right?
The patient, yes. The patient, yes.
All right. So Dr. Jones just asked, which is best for you, uh, 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 transplant or peritoneal dialysis or something? I think the question was. Yeah. What do you recommend? Transplant first or peritoneal dialysis?
I recommend transplant.
If it can be done, right?
Well, if it can be done, if you can get a kidney, if it works,
Right.
if you can afford it, yes, because you do have to take medicine to prevent rejections.
Right.
And some transplant places will not list you until you have a certain amount of money to pay for these medicines.
Yeah. So like we said, they won't list you unless you got the money to pay for the medicines, not
Right,
necessarily the surgery,
right,
but
for the
the
medicine, the
medication.
transplant medicine. It has been that Congress paid for first year of transplant medicine because they're expensive.
Right.
And then it went to 2 years. I think it's up to 3 years. There is something in Congress that will pay for the medicines for the life of the kidney, and I think it passed. But programs are still asking for that money. They want to see it in your bank account. So,
But given the current state, you just brought up something I just got to ask. Given the current state of politics in Washington, and I'm not actually making a political comment as much as I want to see if there's anything that you need to advise that you could some snippets of smartness that you have that you can advise patients like because of some urgency related issues that they may need to get done first, or giving physicians some kind of nuggets of what can we do to help protect our kidney patients over the next few months when we got such turmoil in terms of Medicare and Social Security. Should any tests be getting done right about now that we can need to rush and take a look at anything of any nuggets?
I wish I knew. I mean,
All right, so what I have to say, Dr. Price, is what is one message you would like to give our listeners today as far as your takeaway message on kidney health and disease prevention?
okay, yes, to prevent. And just because you see urine coming out doesn't mean your kidneys are working. You need to go to your primary care doctor. Make sure they do a urine to check your urine for blood and protein, and make sure they check that test for kidney function to make sure it's okay. But you can also, watch your diet, watch your blood pressure. If you have diabetes, make sure it's controlled. Don't smoke. Try not to take these anti-inflammatory drugs, and try to limit your exposure to that dye that I had mentioned. Sometimes you have to have it though, but it's best if you're very well hydrated before and after having these tests. And the other
And
thing I wanted to, I'm
go
sorry?
ahead. I'm sorry. No, go ahead.
No, the other thing I wanted to mention is a lot of people are afraid of dialysis. And even in the hospital, when people come in, dialysis patients, they tend to be very sick. And there are those who are very sick. However, if you were to walk into a dialysis unit, you would not hear moaning and groaning. What you would hear is people sitting around talking to each other. Some people are asleep, some people are watching TV because everybody has their little TV there. And they're very jovial. A lot of them get up and go to work. It's hard to have a full-time job, but they do have part-time jobs. So there are people that you probably never thought were on dialysis and you just don't know. But the people that end up in the hospital who are very sick, people tend not to die of dialysis unless they sign off. And you can do that too. But you have to know that if you sign off and you really need dialysis, you might not be with us very longer. But people die of other things. Heart disease is number one, and infection number two.
I hear from a lot of my patients that are on dialysis that it's a socializing experience.
It is,
Uh,
especially for the older
just
patient who lives by themselves. It becomes a family.
yes,
You tend to sit in the same group with the same patients, and the staff, the nursing staff, they tend to be very nice to them, and
right.
so they like it.
Some of them look forward to going to dialysis, not because they look forward to admire being a dialysis patient, but because they still, they got the kidney issues that they have and the need for the dialysis. So why not make it something that they can benefit from? So they enjoy that socialization moment.
That's true. And sometimes when I'm in the hospital making rounds and there's a dialysis patient there, they get a call from another dialysis patient just saying, "Hey, how are you doing? I just thought I'd give you a call." I mean, so they become very close with each other.
Well, since you mentioned that, there's a support network for that kind of experience with dialysis patients and dialysis patients or kidney patients, whatever. There's support networks out there.
Support networks,
Support
maybe,
network.
yeah, maybe the National Kidney Fund or the National Kidney Foundation has
Okay.
that.
Yep. Just trying to make sure that we afford our patients whatever opportunity we could. Well, look, this has been, I think, for a lot of people, very eye-opening conversation about kidney disease, especially as it impacts the African American community. We learn a lot about the risk and the importance of early detection as it relates to kidney disease and the step we can take to protect our own kidney health.
Yeah.
But most importantly, we need to appreciate the power of advocacy for us to, that you mentioned earlier, engage your family and your loved ones so that this is a process that y'all can experience together because they can help that individual out.
Yeah.
So to our listeners, knowledge is power, but action is even more powerful. Get screened, ask questions, take charge of your health, especially as related to kidney disease, tonight's topic, but all of your health. If you love someone who's facing some kidney disease, remember, you're not by yourself. Support is out there. Seek that support from you, along with your family members, on behalf of your loved ones, for yourself and those loved ones affected with kidney disease. We want to thank again our technological guru, Dr. He says he's a doctor, he's a wizard of technology. We want to thank Tyrone for helping us present this and bringing on this podcast. And to our guests, we want to thank you for sharing our experience, for allowing us to come into your home and sharing our experience and knowledge as to what our topic was this evening. So until next time, stay informed, stay healthy, and keep the conversation going. Pause for the truth.
And there we have it, another episode of the Pause for the Truth podcast in the proverbial books. Our heartfelt thanks go out to every one of you who took the time to tune in. Mark your calendars, we're here every Tuesday at 6:30 Eastern Standard Time. Feel free to join our community on Facebook, Twitter, and LinkedIn. But the golden ticket? Subscribing to our YouTube channel. That's your passport to all our latest episodes and exclusive content. A special mention to the wizard behind the curtain, Tyrone Jackson from Call Tyrone IT Services. His technical prowess and unwavering dedication are the backbone of this podcast. Next week, we'll be back with more. Until then, tell your friends, tell your family about our show. Your support is invaluable. And remember, keep that curiosity alive. Keep seeking the truth.